Hey y'all. My name is Haley Purvis. It's an honor to be on the stage with these beautiful individuals who work in the death space and have a lot of collective experience in aiding and easing the process of dying. Um, hmm. So, wanted to begin by acknowledging death as a doorway and not the end of anything really, but a big, significant spiritual experience and a transition. Um, Death has a very unique relationship with each of us. And while we are here on the stage, we are by no means like experts on arguably one of the most mysterious aspects of being alive and being conscious. Death has impacted everyone in this room, either directly or indirectly, and just honoring the wide spectrum of relationship with this process and this portal. I feel very honored to be here. Last year, I hosted a workshop called Dreams, Death, and Rebirth. And that was a way to sort of honor and acknowledge the gifts that come from loss and the magnitude of change that come along with death. I was personally impacted by a few people that I really love and care about have passed, and that experience just changed my life and kind of directed me to get involved in these conversations in these spaces. um, Big Psych and the community at Big Psych also wanted to take a moment to honor Jeremy Paulson. Jeremy Paulson, affectionately called JP, was a big part of today's event. He was going to speak on the plant medicine as a pathway for BIPOC liberation panel. He was also going to speak on the decentralized wellness panel, as well as the imposter syndrome panel, the neurodivergence and plant medicine panel, and the movement panel. On top of that, JP was helping with the scholarship program, connecting students, community members, BIPOC individuals, and low income to cheap and affordable access to spaces like this. And finally, very in keeping with his fiery, passionate expression of choice, he was also organizing a dance cipher as part of the after party. And JP is no longer with us in the flesh, but wanted to take a moment of silence to honor his spirit because he is very much here with us. So I'll also have everyone kind of close their eyes and call to your hearts anyone that has passed in your life that you want to honor in this moment, as well as the beautiful individual that JP was. And we'll just take a moment of silence here. Beautiful, thank you very much. I'm really looking forward to today's discussion and talking about how plants can aid and ease the dying process, how they can kind of dot the edges of this epic contraction that is dying, and gently guide us and whisper sweet things into our ears as we go. Um, the use of plants, and then I'll get to the first question. But the use of plants in the dying process is something that cultures all over the world throughout time have honored and understood. Amazonian traditions sit with yahe, ayahuasca throughout their life, as well as at the end of their life. Native American cultures understand that tobacco can weave with our prayers and bring them to the spirit world, and help us as we navigate the afterlife. Japanese culture has a very deep connection to the lotus flower as a symbol of spiritual enlightenment, and the lotus flower is often placed on the chest of the dying or the deceased, or lotus incense is burned as a way to promote the resonance of peace in the space as someone is passing. Um, Indian culture also burns holy basil and serves it as a tea for people to drink at the end of their life to promote relaxation and kind of spiritual completion. So plants, both psychoactive and not, are just here for us because they really care for us. So without further ado, I would love each of these panel members to introduce yourself, share a little bit about your work, and really just take this opportunity to express yourself to the room. You can start here. Okay.
Hello, Catherine Campion here. I identify as a psychedelic-informed end-of-life coach or death midwife. I currently serve at Providence Place Hospice in South Minneapolis by my house. That also happens to have a death doula, death midwife training sort of incorporated into serving there. I've been dancing with psychedelics since the 80s, I guess. So that's how I'm psychedelic informed. I'm not necessarily focusing on serving people psychedelics, but like informing them what their options are. And just, I feel like a person on this planet whose life has been shaped by, using so many different psychedelics over the past 40 years. I got involved into death midwifery about a decade ago. I started studying at Sacred Crossings in Los Angeles to be a death midwife, trained in hospice through the Veterans Affairs Twilight Brigade and that program. I think I was like the last graduating class from that, and then trained as a home health aide in LA so I could be with people of all ages as they were dying. And my first client turned out to be my best friend, Mimi Moss, who died of breast cancer at 37, leaving behind a 10-year-old daughter. And that was grad school for me. Like, I learned more in the 3 years I watched Mimi die, and then the 3 days, and then the 3 minutes. Like, I spent the end of her life with her, and I learned so much. And while she was dying, I was thinking, and this was before I knew anything about incorporating psychedelics into therapy or end of life, I had the thought, man, she is having a really awful death. She was terrified. You could tell she was struggling to breathe and wanted to take her oxygen mask off. And I was like, can we just let her take her oxygen mask off and get it over with? But nobody else wanted that, was ready to face that, because she was so obviously dying. And I wanted to serve her MDMA. So I know you talk about plant medicines. I'm personally like probably the most passionate about or most interested in MDA and MDMA at the end of life. It's just this heart opening, like, I accept everything as it is. And interestingly, the father of her daughter was also at her side as she was dying. And her mother was a nurse from Haiti, and her mother moved in with her and took care of her during those final 3 years and is now helping raise her daughter. But JB, her baby daddy, also had the same thought. He was like, no way, I wish we could get her MDMA. And her Catholic Haitian mom probably doesn't want that to happen. Not that we had it on us, but that's when I got on the path of like, can we incorporate these into end of life? Oh yeah, people have been doing it for thousands of years. So that's how I serve, why I serve, where I serve. And please feel free to approach me out there today or tomorrow if you have any questions.
Hello, I'm Grace Nelson. I have been a registered nurse for 5 years now. For the last almost about a year, have been working for a hospice company called Accent Care, full time, taking care of about 17 to 20 patients that I would see weekly at least. Going to their homes, visiting with them. And for those who don't know specifically what hospice is, it is a government-funded program that any person can get on if two physicians deem that they have a life expectancy of 6 months or less. And oftentimes then some people are on hospice for years, some are on for a day. And yeah, prior to working hospice, I worked on labor and delivery. at a high-risk labor and delivery unit at Abbott Northwestern here in Minneapolis. And while I don't have any experience with psychedelics or plants at the end of life, I have personal experience with those myself, and that informed lens moving through my work in birth and now in death has been extremely formative for providing people with the safest and most like sacred spiritual experiences as they're exiting this life. Yeah, it's all about me.
Hi, I'm Kristen Ament. I suppose my journey is more about the death aspect rather than the psychedelic aspect. I am new to the psychedelic space and always like to lead with that when having these conversations. You could call me a teetotaler that dips my toes once in a while. Um, so I too am a nurse and then went on to become a nurse practitioner. Have worked in the ICU and then in both the community and the hospital in hospice and what's palliative care, so the step before hospice. So it's suffice it to say I've seen a lot of people die, some expected, some unexpected. A deviation from my medical journey, I traveled the globe to figure out how traditional cultures met with people who were both living and dying, and that informed my practice when I came back. And I really saw this huge gap in how other cultures support their communities. They rally around one another, how they support the birthing, and those dying as well. And so when I came back and began working in hospice and palliative care, even there I saw just these enormous gaps in not only our system medically, but in our system culturally, and how we've really gone away from supporting one another as a community and um, having some open, honest conversations that sometimes help us pass a little bit more beautifully. And so what I have found from a um, research perspective is how psychedelics and other plant medicines, many plant medicines, can help ease that transition and maybe get people to that place that they've been trying to get to for a long time in their life, but haven't been able to get there on their own. So coming back to just, I guess I could say it's my mission and passion to be able to get people to a place of feeling like it's okay to let go and feeling like they're well supported. And so sometimes that's with plant medicine, sometimes that's with psychedelics, and sometimes that's with deep prayer. So thank you for having me here.
So my name is Nina Gerten, and I am a lot of things. I've been a death doula since 2018, I believe, 2017. Before that, I was a spiritual director, and before that, I was an artist, and before that, I was in corporate for about 35 years. And primarily the work that I do with psychedelics and private clients. I'm also a hospice chaplain for a hospice here in the Twin Cities, and but the only work that I can do with dying clients with psychedelics is if they're private clients, and so I don't offer it to all of the people that I work with. They have to be in the right frame of mind, and there has to be sort of a compelling reason for me to ask them if they're interested. I've had about 10 of my private clients that have taken mushroom trips. I grow mushrooms with another doula, and we raise them very ritually. We have ritual when we bring the spores in, we have ritual when we plant them, we have ritual when we are harvesting. And so it's a very sacred, this is a very sacred aspect for me and for the people that I work with at this point in their life. So I'll leave it at that for right now, but thank you.
So our next question is, how do you see plant medicine aiding aiding in the dying process, and if you're open to share a personal story from your work that deeply touched you or highlighted the psychedelic nature of death and dying. And anyone can, jump in.
I can go. So I had my first client that I had approached. She and I are the same age, and she had been through a ton of trials with chemotherapy, and finally got to the point where it wasn't working. And we had not known each other in college, but it ended up we had been in the same class in college. And never, we had friends that sort of, there was that space that we were in but never met until we were supposed to. And so she wanted to, I talked to her about psychedelics because she was afraid to die. And my experience with mushrooms has been this opening of feeling just love and bliss and trusting that that is whatever source is. And she wasn't sure how she felt about source or God or divine, and she definitely wasn't looking forward to dying. So we made a date for a trip for her, and she took the plant medicine and started feeling just this beautiful, it was just this beautiful unfolding, and the love was so palpable. And she called her husband in, and she was in a recliner, and she called her husband in, and I stepped out of the room, but at the room, and he knelt down next to her. And she was a person who was incredibly cerebral, and to feel this experience of love the way that she was feeling it was just incredible to watch. And she wrapped her arms around her husband, and I think that could have been maybe the first time that she actually was able to say, I love you, in a way that he felt and that she felt. And to see that transformation was amazing. And then she also called in her son, and she also called her daughter in Michigan, and just told them how much she loved them. For her to have had that experience was huge. The second experience that really stuck with me in that particular experience was that she felt that she was agnostic, and I think having grown up Catholic, she grew up Catholic, I grew up Catholic, I kind of got it. But there was something, right? There was something there, but she wasn't sure what it was. And she wasn't sure that she believed that there was something there. She was teetering. So what ended up happening was during her experience, her mom's voice came to her, and she said, "It'll be okay, Pumpkin. I'll be there when it's your time." And had it not been for that, her fear level went from here to below ground. It's going to be okay. There is something there. There is someone that's going to meet me. There's someone that's going to be at my side when it's my time. So that was probably the most profound end-of-life experience that I've had.
That's really touching. It's like very sweet that she was able to access this deep well of love for people in her life that were really meaningful, and also hear from her mom on the other side and be like, oh, sweet. Also, I can't see anything, so if the time is running out, can someone verbally share that with me?
Maybe give us like a 10-minute head up so we can open it up to questions.
Yes, that'd be sweet. All right, anybody else on the panel?
Sure. Do you have one? Okay. So to clarify, we're all dying. So when I say I serve the dying, I include everyone. So I was just thinking, I just served a couple in their 80s who are definitely not dying anytime soon, as far as I can tell, but very full of life. And they actually approached me about doing a journey with them. And they both have 35 years of sobriety. And I was like, oh, do you understand that there are going to be people in your 12 step that are going to judge you? People are going to say you're no longer sober. And they're like, we don't give a shit. They can suck a D. Some really groovy, foul mouthed, rural Wisconsinites. And I have a mentor, Dr. Elliot Eisenberg in the Mission, who I met at Anne Shulgin's memorial. I got invited to at the Psychedelic Science Conference last year in Denver. So I was like, I'm going from Denver to San Francisco to party at the Shulgin. Does anyone here not know who the Shulgins are? Okay, I think most people, yeah. So the Alexander or Sasha Shulgin and his wife Anne Shulgin were. Sasha Shulgin is responsible for the majority of psychedelic substances in the world today, like over 200 substances that he made in his little old dusty lab on their farm outside of inland from the Bay Area. And so I got to go to their farm and go to the memorial. He died like a decade ago and she died a couple of years ago, and they were waiting for the COVID stuff to wind down a little. Anyway, back to the couple in Wisconsin. I consulted with Dr. Eisenberg and I was like, this is their situation. They've been together 35 years of sobriety and they're having a lot of conflict and a lot of fear of death and stuff. So we ended up deciding, he prescribed like candy flipping. So they had not done anything except like alcohol 35 years ago. And I took them out to nature, and I always try to like microdose whatever I'm serving so that I'm kind of on that wavelength. So I had a little MDMA and a little LSD, and we did MDMA and then brought in the LSD as they were starting to come down from the MDMA. And I left them for a while on a blanket. This is 84-year-olds, both of them. And I left them on a blanket, just like caressing each other and cooing and expressing, like vomiting words of affirmation and love over each other. And I really think that healed so much of the wounds. I think MDMA, MDA, that kind of stuff is really good for couples therapy. So yeah, that was a really great experience for me to witness. Like, these medicines can really heal a lot of trauma and a lot of conflict between people.
I love to hear about old people tripping.
Yeah. Groovy hippies.
Yeah, I'd love to share one of the most meaningful experiences I had bearing witness to someone during the active stage of dying. His primary diagnosis was Lewy body's dementia. So that's really an interesting scenario in that, he doesn't really have any concept or had any concept of what was happening as he entered the dying process. And I had the privilege of one time, doing a visit where no family was present. I love when family's present. It's so important. But this was really special in that I was alone with him. And something that can occur, doesn't happen to everybody, but it can happen during the active stage, is something that's almost similar to contractions in labor. And it has to do with the breath. And someone can have periods of apnea, which means that they go a period without breathing for several seconds or more. And then their breath kind of comes back to them. And they regain kind of more rapid breathing and almost kind of a grasping. And then it leaves them again. And I am also a singer and a musician, so I took the opportunity to sing to him, which was incredibly special. And something really beautiful happened in those like contractions and expansions. And it was that in the periods where he ceased his breath, I could feel that his like spirit, his soul was like hovering and was feeling so at peace and so ready. And when it would enter back into the body, the fear was really palpable. And I felt that my job in that moment was just to like help to weave those two versions together and give him a semblance of peace from his own self, from the self that knew that there is actually nothing to fear here. And It was extremely profound and emotional, and I feel so incredibly grateful to have borne witness to that process with him and to have with others. And I'm definitely a novice, haven't been doing this work for, not even a full year, but I've seen a lot already, and it was a beautiful, beautiful experience.
Thank you, Grace.
Sure. I have two that sit on the forefront of my mind, and I'll share just briefly about each of them. The first one was a gay couple from Massachusetts that was, his partner was dying of AIDS, and he was at Mayo Clinic, and so they called and asked if I would be willing to go down there and sit with them for a couple of days. So I did, and on the last day we did a psychedelic journey together, and it was his first time with any sort of psychedelic experience, but he was on his deathbed, and he spoke at length in the beginning about how much shame he had from coming out as a gay man later in life, and he had a family. And that shame was preventing him from feeling that it was okay to go peacefully. There was a lot of things that he had wanted to share with people in his life that he really didn't have the capacity to do. Some family members weren't even aware that he was dying. And this was just about 3 days before he actually died. So he was completely bedbound, very frail, not drinking, not eating. So we had this really potent several-day experience, and on the final day with psychedelics, we had a beautiful ritual, to Nina's point of always making sure to bring in that ritualistic element. And we sat together, and I mean, what it did for this man who was dying, it allowed him to see the conversations that he wanted to have with the family members that were important. It allowed him to open his heart to compassion for himself. A lot of what he was holding on to was his self-shame, and he was able to get rid of that and just see from a different lens. It was incredibly beautiful, and he had been through therapy for decades and had never gotten there, and it was just within that one day that he was able to cross the bridge to the other side of feeling like it was okay to let go. And that was very, very special. I felt very honored to be there with them. And then quickly, in my other experience that really sits with me is around grief. It was a young man. He was a corporate lawyer. He came in with a polo shirt on. Not to knock polo shirts. It was just an interesting noticing. And he was really rigid and, not really open to ceremony. So I had a gentle ceremony not to scare him. And I have to tell you, it was one of the most transformative experiences I've ever seen, because he lost his dad very young. His dad was a missionary, and he and his family would travel around the world to different places, and his dad's plane crashed when he was 6. And the family had just gotten back about 3 days prior. So he carried that with him I just got goosebumps all over. He carried that with him for a long time, and he came to me because he wasn't able to get over that grief. And he said, as a father now, I don't remember, I can't access those memories from my dad that I wanted to access. And I feel like there's a huge void. I know we were tight. I know we had a good love, and I just can't go there. And in this experience, he had like a 3-hour-long conversation with his dad. And all those memories came flooding back into him, and I was sitting there like tirelessly writing as he was, telling me what he was witnessing, and it was just really beautiful. So we both felt his father's presence very, very closely and palpably. Whether or not you believe in that or not, whether or not it was placebo or not, it certainly was impactful for the both of us, and specifically for him. So.
It's really beautiful. I'm feeling so emotional, honestly. I'm also feeling curious to pose the question looking. Oh, perfect. Okay, yeah, sounds good. If anyone in the audience has any questions or comments, now would be a great time. And I cannot see a single
In the way
thing.
back?
So for the people who are dying and they take psychedelics, what are some physiological symptoms they may have? And physical? Do you see an uptick in energy and vitality?
I'm going to say no, but I haven't seen everybody on psychedelics die. So the limited sub 50 people that I have seen on psychedelics dying, I would say that's not been my experience. But what I will say is that the breathing that Grace was mentioning, agonal breathing is what we call that when we're gasping. When they're having that, that often lessens. I've noticed that it just becomes, even though it might be more shallow, it just becomes more regular and more paced. The only thing I have witnessed is some intensified nausea. And so sometimes what I'll have people do is pre-medicate with some sort of an antiemetic, anti-nausea medication. I hate using medications in ceremony, but with somebody who is terminal and on other things, I do suggest that they take some sort of an anti-nausea medicine a couple hours beforehand.
And I would say, of the terminal clients that I've worked with psychedelics, I'm always very cautious about, what's going on with their liver, what's going on with their kidneys, what are your numbers. And a lot of them will go to their doctors and say, I need to know so that I can do this trip. And, which I think is great because they're advocating for themselves and for what they want. What goes on is a spike in blood pressure, hot, cold, nausea. I've only had one person that's thrown up because of feeling nauseous. Usually people are willing to kind of ride through it. But yeah, so, and most of the people that I've worked with have not been like at the end of their life. They're terminal, they're on hospice, and it's usually been within maybe 3 or 4 months of death.
Any other questions? Or comments? Yes.
Can I just really quickly add on to that? If this is something that intrigues you, one thing I would say is finding somebody out there who maybe is a psychedelic-informed pharmacist to make sure that there's not a contraindication, because some end-of-life patients are still on medications, and you would hate for it to have adverse effects. So I always check with a pharmacist that I'm friends with that's psychedelically informed. So just I feel like introducing like just the smallest element of caution with people who are end of life and are taking maybe some medications is safe.
Yes.
So when you have end-of-life patients that are coming from a religious background, whether or not they are still identifying a member of that denomination or agnostic, atheist, have you found that that makes a difference in how they experience those trips at the end of life?
Have you ever read the text Life After Death by Deepak Chopra?
No, but I know of it.
Yeah. In that book, he details, he's a neuroscientist and a spiritualist, and he details that the beliefs that people have held about the afterlife or God typically are what materialize for them in that setting. So again, like we have such power in our beliefs and our choices and our relationship with God, and like cultivating that safety and that connection and that love with God while we're here through prayer and movement and other things can really like show itself in the final stages of life. That's what he says in that book. Does anyone else have anything to share?
Yeah, I would also say that the beauty of psychedelics at end of life, when people are in a resistant relationship with whatever their faith was or their dogma or their experience, it lets that go I have seen that many times. It just lets it go, and they're able to die way more peacefully, trusting in that bliss and that love and that other feeling of what is beyond this. So.
I also feel like with death, there can be such a contradiction, like being so scared to die and also kind of like wanting to, and like balancing that desire to be released of this like burdenous like life and also being scared and loving what you have here and like wanting to hold on to it as like strongly as you can. And I think plant medicines help us hold both. Um, they're great for dichotomy. Any other questions? Dosage or strain recommendations?
I just think dance with the substances, learn the substances, and you'll find what calls you to serve, and getting to know your clients and your friends and family, and then customizing individually. It's definitely not a one size fits all. So there's dozens, if not hundreds, of substances to choose from. So yeah, familiarize yourself and offer options.
I think we have time for like two, maybe three. Any other questions or comments?
Yeah, in the back.
Yeah. Talk about the money.
I'm happy to start on that one. So yeah, private practice cash pay. I didn't charge for the longest time, and then I realized that I was just being foolish. But there was something around the ceremony of it and the sacredness of it. As a white woman, me feeling very aware of generating any sort of monetary value from that felt misaligned within me. But my time is what is not misaligned to be okay to charge for. So I probably am cheaper than most people, but that's not why I do it. I also am doing it, and I tell everybody that I sit with that it's word of mouth only, and they must ask me first because I have a medical license, so I could lose that in a heartbeat. So don't say anything. But also, one thing that I say is that I find it interesting that our system is about to make legal in many places the ability for providers to sit with people with this medicine. And by law, we've not been able to sit with people with this medicine. And so how do we feel safe enough to be able to do that the moment out of the gate? So I always tell people, I do feel qualified to do this for you, but also this is research for me so that when it does come along, I'm able to say, yes, I've encountered this, and yes, I've encountered this, and yes, I've experienced this, because I just fear that the moment that the floodgates open, we're going to have a lot of people that haven't sit with the medicine and abuse it for monetary gain. So that was a long-winded answer, but yeah.
Yeah, and so yes, mine is all private practice, and I do love offering, so it's not a set price because I don't want cost to be a barrier to someone doing something that they need. And so it ranges all over the board. And the amount of time I do pre-work with the client, I do intentional work with the client, I do the trip, then I do post-work, and then I do 2 week later post-work. So it ends up being about 10 hours of my time. And I'm BIPOC, so I also believe that our gifts and our abilities and what we've been given by whatever source is, there is this beautiful symbiosis between whoever is using using the mush. In my case, it's all mushrooms, and myself. And so, thank you. Yeah, it's always a lot of gratitude, and it is a sacred threshold experience for me.
I did just get the 5-minute warning, so we do have some time left, actually. There's a question here.
I'm curious about your experience
Yeah, I recommend people just go volunteer at a hospice, volunteer with friends and family. We all know people who are dying. So just say, like, hey, do you want to talk about death? Like, that's actually a big service I provide. A lot of my friends' parents are dying. And so they're like, hey, I don't really want to talk to my dad about his dying. Will you do that for me? Or the dad will be like, hey, I don't want to be here anymore. And my wife doesn't want to hear about it. And my friends will be like, oh, you know who you should talk to that about? So yeah, back to the idea of like the payment thing too, is a lot of my clients just like take me out on dates basically. And I get whatever I want. And then I just talk. I just talk death with them because nobody else wants to. And I'm like, yeah, I want to talk to you about your impending death. So yeah, that's one way that I serve, and one way you could volunteer is just get out there and get experience by sitting with the dying. The hospice where I volunteer, Providence Place, we're always looking for more people to sit vigil, especially, and it will include like death midwifery training or death doula training because we have like monthly meetings and we'll recommend books and stuff. I don't know. Any other ideas of how to get just volunteer? Yeah.
The only way that you can really get into the death work is if you start out volunteering. I mean, I think people throw up shingles and they've gone through the classes or they've gone through whatever and have never done hospice work. They've never volunteered with hospice. And that to me doesn't sit quite right. I feel that we need to dive into that world before we can start, inviting people to work with us on a private client basis. So, yeah.
All right, cool. And
more?
last question. Is there one there?
So I was drawn to this topic and being here because my grandfather passed away right as the pandemic was beginning, and um, he wanted to do ayahuasca as a goodbye, and I feel that the family just didn't support it. They took him to a hospital and he died there, and so part of what I'm feeling that needs to happen is the end of life planning needs to incorporate the family. I know it's easier for the kids to be like, hey, go talk to my dad, this thing, I don't want to talk about that hard topic. But the problem about leaving them out of the conversation is that sometimes the 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 wish of the person that is dying doesn't end up being honored. And so I don't know if you incorporate that,
Yeah, so you're talking about like a healthcare directive and a death care directive, which everybody over the age of 18 should have. There's ways you can do them online. I think there's people locally who offer free to inexpensive workshops. So if you just Google healthcare directive is really like more how you want to die, and then a death care directive is making some sort of plans for what you want done with the corpse afterwards, whether it's a party, not a party, incineration or green burial, or being pickled or whatever. So yeah, I think those are good conversations to have. I threw a little let's talk about death party I'm the baby of a big Irish Catholic family, and I just got the whole family together and I was like, I got 12 copies of our healthcare directives. Let's fill these out. And then we did like a brief death care directive as well. So yeah, that's a really good point.
my family started microdosing after my grandfather passed,
Mm.
and then they understood why my grandfather wanted to go
Uh,
that way.
was he Latin American, your grandfather?
Yeah, Native
Oh, wow, and he didn't get to do ceremony.
Yeah, and I think what you're kind of getting at is patient-centered care. And as an end-of-life doula, that patient is my first, he's the drop in the middle of that pond, right? And then that family is that first ring, and I'm always working to make sure that the family is working with the patient and with myself so that they do get what they want. And sometimes family members don't want to be a part of it, and other times family members are in. So every family is different, every situation is different, and our job is just to roll with that as we can. But that patient, getting them what they want is the primary deal. Primary deal.
I think you spoke really beautifully about like just a cultural societal need to like soften around conversations about death and mortality and how fleeting everything is, and just yeah, softening and being more relaxed in the face of that, and also honoring any tension or like rigidness or fear that comes up in the face of that. But I really appreciated the way you worded what you just shared, and I guess maybe this is bold, but I pray that your family like felt connected with your grandfather after sitting with mushrooms after he passed, and like can also honor the way that that the cookie crumbled, you know. So yes, this is all the time we have. This is a big topic, and are we all open for continuing the conversation later? Cool. Thank you, Big Psych, for the opportunity, and thank you.